Dr. Triffy here. If you want to check me out, I'm at drtriffy.com, which is drtriphi.com. Today I am doing a second video on suicide, suicidal ideation, what suicidal behaviors might look like, what suicidal thinking looks like, when you need to be concerned as a family member. And I'm directing this to family members of people who seem to be suffering. I say seem to be suffering because often we might pick up on family members just not being themselves, just not looking right, just not feeling right. Here's a couple things I want you to pay attention to. There's something called passive suicidal ideation, which is where a person doesn't come out and say, I'm going to kill myself, or I'm going to take some pills to just get this life over with. A person might say something like, I'm so tired, I'm so exhausted with this life, or I just don't even care anymore. Who would miss me? Ugh, what's the point of this? It's passive, right? And you, as an individual, you want to pay attention because in your mind, you might not have an active plan. Again, you might not be like, okay, I'm going to slash my wrists tonight at 10 p.m. But you might find yourself thinking thoughts like, I wonder what it would be like just to run across traffic right now. Or I could just end it if I threw myself across this train platform. Or who would miss me? I just don't even want to get up anymore. This is when you know you need to reach out for help. The quickest way anywhere, especially in the US, is to call 911. If you're not in the US, get to a hospital. Talk to a family member. Talk to somebody you trust. Talk to a teacher. Talk to your friend. Speak up. There's nothing wrong with having a mental health issue. Mental health is really just the brain working itself out. Okay? If you have physical issues, I mean, think about it. You have an annual physical exam. If you have physical issues, why would you not have brain health issues? If you live long enough, even if you are not predisposed biochemically to depression or anxiety, you will experience something in your life that hurts so bad. You might have a depressive episode. You might get thoughts like, what's the point of this life? Like I say, if you live long enough, you will. So this is not a matter of weakness. It's not a matter of, oh, we don't have that in our family, or, oh, these people over there, they suffer from this, but we're fine. You know, we love the Lord and we can pray and we know how to cast these demons out. It's not demons, okay? It's not these other people. It's just your brain. And sometimes the brain needs a tune-up. So I recommend seeing a mental health professional at least once a year. The same way you go check your dentist. I mean, you check your teeth out at least twice a year, right? You go for a little cleaning. You have a physical exam at least once a year. If your mind is not working right, if your brain is not working right, no matter how great you feel in your body, it is so psychically painful to be in that body if you're not caring for your brain. So my advice to you is at least once a year, check in. You can start with your primary care physician. When you go get your annual checkup, just, talk about your feelings a little bit. And you can ask your doctor for a screen. There are depression screens, there are anxiety screens that don't take long. And you can get an idea of whether or not you need to talk to somebody else more in depth to help you feel better. So again, I'm Dr. Triffy. My website is drtriffy.com, drtriphi.com. I hope you practice thinking better so you can feel better and you can do better. Peace out.